Hello, I am Dr. Jesus Juega, neurologist from the stroke unit at the Hospital Universitario Vall and I am going to explain you the importance of doing a follow-up and carry out a study to find out the reason for strokes of undetermined cause. It is important to understand the cause of a stroke because different causes require different secondary prevention strategies to avoid new events. In this sense, within a stroke, it is considered that approximately 25% of cases they are secondary to atherothrombosis due to large vessel disease, 25% to cardiac diseases, 25% to small vessel strokes associated with vascular risk factors, 5% will be exceptional causes, and around 1 in 4 people will suffer a stroke of undetermined or ketogenic cause. In many cases, when strokes are called indeterminate or a stroke of unknown origin, it's because after the test carried out, it is not yet known what their cause is. When a person suffers a stroke, the first thing that will be done in the hospital will be an evaluation by a neurologist and imaging tests will be performed, head CT or MRI to see whether or not there is any structural injury. Once we know that a patient has suffered a stroke, we must perform a series of tests to understand if it is due to some pathology or disease of some part of the body. To do this, depending on each case, studies of extra or intracranial circulation, studies of cardiac morphology and function, and the studies of monitoring the electrical rhythm of the heart are performed. It is relevant to do these tests since in a high proportion of patients who have a stroke of unknown origin can also be related to a heart disease. The most prevalent heart disease is an arrhythmia called atrial fibrillation, which in many cases is hidden because up to 50% of episodes of this arrhythmia do not cause any type of clinical symptoms. Therefore, protocols must be carried out to detect if they have an arrhythmia that could cause a new stroke. There are different known strategies, either with textile Holter or other devices that allow us to monitor the heart rhythm for a long time and detect asymptomatic atrial fibrillation. This is relevant and allows us to adjust the treatment to avoid another stroke, improving our health and quality of life. For more information, you can contact the stroke unit through the NORA chat.